All right, it's Wellness Wednesday, and we're going to learn a new set of words helping many people develop healthy behavior and challenge negative thoughts. Here to help us understand cognitive behavioral therapy is Dr. Quinn. Good morning, Dr. Quinn.
Good morning.
So, Dr. Quinn, what is cognitive behavioral therapy?
Well, cognitive behavioral therapy, which is referred to as CBT, is a form of therapy that many medical providers use, including primary care physicians, psychologists, psychiatrists, and it's very effective. What we do is we focus on the thoughts, the feelings, and the behavior. For example, we have a lot of patients that come in that benefit from this type of therapy that we initiate, where they may have bad thoughts about their weight. They feel they're overweight and they have negative feelings. They feel it's just, there's no hope. There's nothing I can do.
Right.
And because of the way they feel, their behavior reflects where they don't even try to exercise or don't even try to eat healthy. And it just, they continue to maintain the same unsatisfactory weight or either gain weight, and it goes back and makes them feel even worse, and then their thoughts are even worse. And what we do is we focus on the behavior aspect. We ask them to discuss with us possible ways that we can get to a healthier weight, such as walking 30 minutes 2 to 5 days a week starting out, and keeping a food diary where they will email it to us. And what we do is we change the behavior, which they start for some people when we do it well, and then their feelings change because now they're getting to a healthier weight. They feel empowered, they're less discouraged, and their thoughts about their weight are improved because they feel, hey, I'm gonna get to that weight that I really wanna get to. And it feeds back all the way to the behavior where they'll walk even more days a week and eat even healthier and lose more weight and get healthier and healthier. And at the end of the day, it worked. So basically, it's like this glass right here. You can see the glass as half empty, which in a lot of cases they are when they first come, but after the cognitive behavioral therapy, they feel the glass is half full.
Right.
And that's the one, and that's where you get the success.
Absolutely, Dr. Quinn. I love that analogy, too, because you also said something about kind of like that cycle. So when you're in a negative mindset cycle, you're not going to get to where you want to be. So to get your patients to those goals, you've got to kind of shift your mindset into thinking a little bit better and to change your behavior before you see any results. So I just love that so much. Who can benefit, though, from cognitive behavioral therapy? Is it everyone or a certain group of people?
Well, pretty much everyone, including me. I mean, I studied it a great deal this week in preparation for this talk, and it talked about how a lot of therapists use it for depression, anxiety, social phobia, just day-to-day things. Like, say, for instance, someone has really bad anxiety, and they feel that they have thoughts that if they go somewhere, everybody's going to be mean to them, or they have feelings that they're just going to be perceived as stupid, and their behavior is they stay at home, they stay withdrawn. And if you can help them understand that these thoughts are not the reality, the people, they like you, and they'll change their behavior and start going out and getting a positive feedback because they have a more positive attitude. Like, instead of like, hey, how you doing? Hey, how you doing? It's just a different, you change people's perceptions of the situation. In a lot of cases, if you can do that, they'll get a better outcome. But this is very effective, even for alcoholism and drugs, which are negative coping mechanisms, behaviors due to negative thoughts and feelings. And if you could just change these behaviors, then the person is a better person, less anxiety, less depression, and an overall more productive, happy life.